house. We could go out. We don't got to wear it.
Right.
I really.
Yeah, and so the video, I'm not sure because there's a little bit of a delay, but the video you're seeing and it's popped up, that's the video we're hearing is of Taragi Beach.
Right.
And people are out there socializing. Oh, there,
Yeah,
you can
wow.
see no masks. And then there's the other video of the sailors who are coming off of.
Right, and let's get public health onto the line here. And I guess just first question we have for Annette and Dr. K, the Chief Public Health Officer, I guess would be, does public health have the authority to enforce these measures that are being placed on I don't even know how to describe ourselves, the residents of Guam? I mean, yeah. Do you guys have the authority to go into the base and be like, hey, no, put on your mask, no gathering? Ladies, good morning.
We do not have authority to go on base and enforce those because they're on base. So we have no jurisdiction on base.
So there's absolutely nothing the government of Guam can do. Is that what you're saying?
Correct, not on base. We cannot enforce our laws on base.
You could write a letter or something, though, right? I mean, could we write a letter?
We could write a letter, say there's concerns, but we cannot go beyond the.
But Dr. K, you're the chief. You're the chief public. Dr. K, you're the chief public health officer. Correct.
Correct.
When you see those videos, how does that make you feel, though? Are you like cringing inside, or are you just? How do you feel about it when you see that?
Well, I think it's just like a double standard for people outside the base and on the base. So everybody outside the base trying to follow all the orders of the executive order from the governor. We're trying, and if you see that on base, it's just like, it doesn't help that they're doing that in there because it doesn't promote the social distancing or so. I don't. So we have no ability to enforce it inside the base. I'm just saying we can do it outside the base. We can tell our people, please social distance, wash your hands, wear your mask. But we have no jurisdiction on the base.
Right. But when you saw it, though, were you like, what the hell?
Yes. Like, oh my God. I mean, it's just very demoralizing that we're doing our part, but that they're not doing their part. And so it's like a double standard, everything on base, okay, do whatever you want. But here outside, we try to do whatever we can. Right. So it's like disheartening. It is.
So who's right, Dr. K? Who is right? Are they right or are we right?
Well, I think they should be following CDC guidelines like everybody else. They are federal, right? So they should be also promoting, everything we're doing outside, mitigating the spread of COVID. And so I don't see any reason why they should not.
What about the reason that we got in the press release from Joint Region Marianas where they said, because these sailors were all packed into this ship for the last 100 days, they don't have to wear masks. They don't have to social distance. Does that, in your medical opinion, Doc,
right,
as a chief? Go ahead.
See, that just because they were all together in that ship, that doesn't mean they're not with anybody else outside that ship, right? So if you're associating with people outside that ship, you probably will get COVID if somebody you were seeing had it, if you would get it. But that doesn't mean that everybody in that ship are the only ones that congregate each other. That doesn't mean they're not actually associating with other people outside that ship, right? So it only takes one person that can spread that COVID to that ship. And I don't think they realize that. Just one person can introduce that COVID.
Oh yeah, the military's jamming your signal right now, Doc. Right, I think the military. Hold on, Doc. Okay.
I'm sure there are other people.
You're right. All it takes is one person.
So disappointing. What did you make of the video, Doc, of Taragi, where it was someone driving by Taragi and you just saw, I mean, this looked like pre-COVID.
Correct. And so I don't know why they're not taking it as seriously as the people of Guam are, right? And so I tell you, it only takes one person to introduce that COVID to that ship, and that whole ship will go down. I'm pretty sure, like the Roosevelt.
Wow. And that's what I'm saying is like, hello, you might have heard about the frickin' Teddy Roosevelt. Google it. What about the Taragi video, Doc, where we saw somebody filming Taragi and it was just so many people, no masks, you know, no shirt.
It's actually it's frightening actually, right? It's really it's frightening that they're not following the rules. I mean, I'm telling you, it's scary. It's because especially all these positives we're getting, you know, the community it's a lot of positives outside the base, right? And it only takes one person to go in there, you know, maybe a retiree or somebody like a guard person go in there, right? You know, you don't know. They may not know they're positive, right? Because it's asymptomatic,
Right.
you know, so it's scary that they're ignoring all these protocols not to congregate, right? No partying, no barbecuing, stay home. And so it's scary, to be honest.
Yeah, they should get a spanking. Doc, let's just go ahead and the other real controversial part of this lockdown, and I want to maybe if you could address it from the public health standpoint, and this has been the thing that just people are still talking about, the prohibition of the use of public parks and beaches for individual physical and mental exercise. What is the reasoning behind this restriction? And then we can get on into the public health stuff because I know a lot of people are listening and they're wondering about why we can't go run on the side of the road. So if you could give us what's the public health reason for that?
It's just to encourage people to stay home, essentially, right? That's actually the gist of that. They just want people to just stay home and not go out, even to exercise. I'm sorry, right? But it is just to mitigate the spread. That is it. They just stay home as much as you can. I know you want to exercise, so maybe you can exercise at home. You're right. But I think that's the main gist, is just to stay at home. Because maybe you can be running in the beach, right? And then you see friends, then you'll start talking. You know, that kind of congregation, they discourage that.
Right. Okay.
Just real quickly, somebody had asked this question. This prohibition of the exercise, the beaches being closed, that doesn't apply to the national parks, does it?
In the,
Like the Essen Memorial Beach Park?
you know, I don't know.
Okay.
I don't know if it pertains to the national parks. I do not know.
Well, I mean, I think if it doesn't pertain inside the base, then that's federal.
I know, but
Yeah,
I just
yeah.
wanted to see if
No, no,
public
no,
health
yeah,
could
yeah.
Yeah.
answer that.
Yeah, I don't know.
I
I don't
get-
know about national parks. I don't.
Hi, Annette. Good morning, Annette.
Good morning.
Good morning, Dr. K. Now, welcome you guys to the show. And then the third thing that I kind of wanted to ask was, where are we with the backlog of tests? I know we spoke last week, and you guys had said we had 1,000+ tests in the freezer. But people, man, ladies, my phone was blowing up from people who have COVID. Pretty much, they believe they have COVID. They're very sick. They went to go get tested. They haven't got the results. But at this point, they're like, keep it. Where I'm staying home. I mean, man, Annette and Dr. K, I know a couple really healthy. I'm talking like Kabalzu. These guys are oxes. And they're really down with the COVID. And one of them is our powerlifter friend, Big Tone. We've featured him here on the KUM. He's supposed to come on this morning.
He's feeling really sick, and so he just can't come on. But you know, he does want to share his story and let us know. You know, like again, as Chris said, that he went to the community testing in Jigo last Saturday or 2 Saturdays ago, and he had been waiting for his test results, and he never got it. So he went on social media and he said, "I don't need my test results. I know I have COVID." And he's just one of just hundreds of people. We have a coworker here that got tested Sunday at the SDA clinic, and he still hasn't gotten his results. So again, where are we with these specimens that are in a freezer over at Public Health?
Well, our public health lab, along with the support from DLS, have been testing every day since that overwhelming turnout on August 15th. And so today we will finish all of the GIGO outreach and whatever specimens were delivered to us. Again, public health worked through the weekend, late nights, and so we finished what we have in our possession for the Saturday events, and then DLS will be finishing their remaining today, and so that will complete. And again, results will be coming out either through phone call by the public health nurses, the call center nurses, as well as if you requested by email. And then through the week, our staff continues to process and test any specimens that were delivered. And again, Public Health Lab receives about 100 to 200 specimens per day. This is not counting the community-based testing outreaches that we had with that large number of almost 1,500 specimens in one day. And so again, our team is working diligently. We received our shipment of one of the testing platform test kits, and so that's why over the course of the past 3 to 4 days, you've seen us report out more than 300 tests per day. I mean, there's been two days where it was 500 or more.
Right.
And so again, our staff is working to catch up with the backlog, as well as balance the priority specimens that are being delivered from hospitals or the clinics or from quarantine.
So did you just say, just for complete clarification, that the 1,500 that are in backlog will be cleared out today?
Yes, Public Health Lab has completed what we have in our possession, and then DLS is completing what we provided to them. They have informed us it'll be done by today. And so results have already been pushed out over the weekend from what Public Health Lab has completed and received from DLS. And then when we receive the results today from DLS, we push that out as well.
Annette, you know what I was hearing was that a lot of people who went to go get tested, I mean, we've done our part. As soon as you guys told us there was a backlog, I mean, we rolled out and we really we tried, and all the media has really tried to put it out there. But there's some people who got tested and think because they never got a call back, they're negative, and they're going around, you know, I mean, hopefully they're staying home, but.
Yes.
And I guess, you know, now that we're not doing the mass testing, I also wanted to ask, do you guys believe that positives are getting by us now that we're stuck in this position where we got to play catch up with these tests? And
well, unfortunately, with this novel virus, we have seen time and time again, not only on Guam, but even in the mainland and in other countries, that there are healthy, asymptomatic individuals who have the virus and unfortunately felt perfectly fine and was going about and doing, you know, going to work or having get-togethers. And so that's why this battle with coronavirus has been challenging and long, because it's different from the previous pandemic flu we had back in 2009. And so again, we just have to emphasize to individuals to stay home, practice social distancing, cover your face with a face mask, and to wash your hands frequently, because again, you don't know. For those who are symptomatic, we are still hearing also reports, and when we do our case investigation and contact tracing, oh yeah, I was sick and I went here, I went there, I still went to work for a few days. And so that has added on to our challenge of trying to contain this virus. And so unfortunately, we're here now with a lockdown, and it's the measures that the governor and the department, as well as the physician advisory group want. It's the last resort. But again, as our numbers kept rising over the past few weeks, we had to take these measures so that, again, we can bring the numbers down, stop the spread, and contain it, and so that we can slowly reopen up again.
I wanted to ask, because we had heard that there's a new public health directive to private clinics that they stop close contact testing as of today. This is not a clinic decision. Can you guys explain to the public why, or are we not allowing public or private clinics to test for COVID, Dr. K?
Okay, you know, several clinics were given Abbott ID machines, right? So these are point of care machines. So for example, once you swab a patient, it goes straight into the machine. So these are the machines we've been using at the Northern Community Health Center, right? So these clinics are provided these machines to test patients. So no, we did not stop them from doing testing on patients. They're more than welcome to use those machines. We provided them the machines. We provided them the test kits, right? And so there is actually no reason why they should not be using those machines. So there's about 7 clinics that are able to use those machines. That was the purpose of us giving them those machines. So they are able to test patients on the machines. So we did not stop them from doing community testing, really. It's just that we prevented them from doing mass community testing, because these machines can only do one every 15 minutes, for example, right? But it's still, it'll help the Guam Public Health Laboratory with the number of specimens they receive if they can test at their facilities and help with the testing at their sites. So we did not stop them from doing community testing.
What
It's just that
about
we didn't prevent.
what about close contact testing? Were they directed to?
They can do testing on those. They can do close contact testing on those machines.
So no directives at all
No.
out of public health for
No.
any sort of a stoppage of any sort of testing
No,
related
no,
to
we
COVID.
did not stop them from. We did not stop them from testing their patients. We did not. It's just that we discourage mass testing, like hundreds of people in one day, because we cannot. We're not going to be able to test that at the public health lab. That's what happened with on August 15th, because there were so many at one time, right? So if we can have them test at their individual sites, right? So even if it's only 30, 40 people a day, that's 7 clinics, that's almost 300 people they can be testing in one day. So we encourage that. We encourage them to use those Abbott machines. We provide all the tests, we provide all of the supplies, we provide the machines, so we're not discouraging them from testing their patients. We are not. It's just that maybe it's not the number they want to see, but it's because because it takes 15 minutes for one test, right?
Right. And
But it's still you can do 30 in a day, and then times 7 clinics, that's almost 300 people that can be tested in a day.
Right, but the rapid tests need to be sent to public health though? I mean,
No,
right.
Yeah.
So we're talking about the other tests, right? The ones that take like 24 to 72 hours.
yes. So depending on the method that you use for the Abbott ID, you literally have to swab and then put it in the machine because that's the point of care. If you use a different type of swab with viral transport media, then that one is where it's collected and brought over to public health lab, and you either test it, if not, refrigerate for 72 hours. If you don't test it within those 72 hours of being refrigerated, then you must freeze it, and then you can continue to test. And so there's different testing platforms that have different turnaround times. And so that's where public health has both the ABI machine, which does take a few hours to process specimens because you have to do extraction and then run it in the machine. That one runs like 29 specimens per batch. And then you have the Gene Expert, which is a 45-minute to 1 hour turnaround time, but it does 16 specimens per batch. And so that's where our team is running throughout the day into the night. And again, it takes some prepping of the specimens to process it, do what's called a manual RNA extraction to put it into the machine and to run the test, and then they wait for the results. So these 2 machines are running while the other machines that Abbott are being used, as Dr. Kaneshiro mentioned, at the clinics that we've provided, as well as our Northern Region Community Health Center. And I just want to go back again. The issue of mass testing is that we can't do what's called casual testing. Public Health has already put out a few days ago about we need to shift our focus to the high priority, the contact. So yes, we don't see this experience again of identify close contact, symptomatic individuals waiting days for the results. And so it's a balance of going back to let's focus our efforts on the high priority, those also in quarantine, those who are symptomatic, those we know are close contacts, as well as those who need a clearance because they have to do a surgery, and so it's like a pre-op clearance. And so those are the things that public health is emphasizing, that that's our focus as we move forward, and to catch up on that backlog that we had from the previous GIGO outreach and the mass testing at our private partners.
So now that public health, as you said, is going to be caught up with the mass testing from GIGO, will community testing resume for, I think it was Jotnia is where we left off?
Yeah, I think Umatic too had canceled, right?
Yeah, at this time it's been postponed. So even though we're catching up on the backlog that we got from the August 15 turnout, we were still receiving hundreds of specimens from private clinics, the public, as well as the public hospital and private hospital throughout the week to test. As you see, we've continued to report new cases, and so we would have to focus on the newly identified close contacts of these new cases, again, so we don't create this backlog of waiting days for your results. And so that's what our focus is right now, is to see how this lockdown helps decrease the number of new positives, so that again we can contain it and focus on the identified close contacts, be it at home or at work.
Right. Ladies, we wanted to bring on Dr. Hoa Nguyen of the Governor's Physicians Advisory Group, just because we're hearing conflicting things, Dr. K, about this new public health directive. So, Doc, we're going to jump you on into the Zoom room. Are you there, Doctor?
Yeah, hi, it's Dr. Nguyen.
Okay.
You know, the problem is that, I don't think, the public health know, and I tell you, we're going to have a meeting on Tuesday. The Abbott machine ID, yes, several clinics have them. They use as a point of care testing. Clinic now typically see every day from 50 to 70, sick visit per day. And the Abbott machine take about 20 minutes to run each test. So you got overwhelmed with sick patients coming in. We try to find out who's positive, who's negative. For testing for close contact, that usually go, to the private insurance or the public health. It cannot be done on the Abbott machine. Go down and take a look at how we run every machine there. If that's the purpose that you give to the clinic to do for close contact on top of sick visit, one machine in each clinic, it's not going to work. We're not asking for mass testing. Mass testing is something requested by public health and asks us to help. We don't do mass testing in the clinic. We do sick visit, to find out if they're positive or negative. We don't even do testing out. We don't have the ability to do that, On the machine, we got to take 15, 20 minutes. And again, we have 50 to 75 sick visits a day. And that's something that public health need to put in public, so public health, the public know there's a limitation on the testing per day of public health. That's the reason why it's a directive from public health, say the clinic cannot usually do the close contact anymore. If the people come into the clinic, they get mad at the clinic, they yell at the staff because now we cannot swap them and send the public health no more. And that's because it's a public health directive of the limitation. So you have to put out the things straight here. Either public health doesn't understand the process, or there's something wrong here. But we don't want the private clinic to be yelled at by the patient that walk in for close contact that we cannot do them. The swab only lasts 2 hours. When you have 8 swabs that wait in line, you cannot swap anymore. It doesn't last a whole long. So it's really need to go out there, let the public know you can run 253 tests a day. I instruct all the clinic today. If anyone come in that have close contact want to be tested, they will be sent to public health, all location. Private clinic cannot do that anymore. We cannot be yelling at the patient. So, you got to get message straight out there. Clinic don't do mass testing, only one time, because public health and the governor asks us to do that. We don't do mass testing every day. So you have to be truthful and tell the public there's the limitation on the test you can run per day,
Right.
and that's is what you want to hear.
Thanks, Doc.
We don't
So,
want to get yelled at.
yeah. Dr. K, and I think we asked this last week, how many tests can public health run in a day?
So with the Gene Expert, it's about 200. With the ABI machine, it's about 87. So that's about almost 300. And
That's
those
the
two
limitation.
machines.
So we are,
So-
we're very limited then.
So
I'm sorry to say that, but it's just that the clinic really going to be under a lot of pressure. FSP, SDA, AMC, Dr. Gago Clinic, Dr. Clinic, we're going to get all yelled at every day now. So we're going to say that's a public health directive, and you got to go to the public health center. If you have close contact, you want to be tested, because we cannot afford to try to do what the best we can to implement public health, and we get yelled at the same time because people will understand that will think that that's a clinic decision. It's not.
Yeah. Okay, Doc.
So
Yeah. Thank you for
Okay,
that,
so-
Doc. And Dr. K, I guess you can clarify when we thanks, Doc. I know you got clinics, so we'll let you go.
Thank
and
you.
Thank you.
Okay.
Appreciate
you.
it.
Bye-bye.
Okay. Right.
Thanks.
So, Dr. K, your response, I guess, to that?
Right. So they can still test. We're doing target testing for example.
Right.
And so we encourage people with symptoms to get tested. We are not going to turn those away, right? But we can't have everybody who's asymptomatic be tested because that'll just take up a lot of the testing, right? So we want to prioritize people with symptomatics and close contacts.
Sick
right?
people. Yeah.
It-
I get it.
Right? We just can't have, by the way, I had somebody at work who was tested for positive. Oh, let me get tested. Even though you probably weren't even close contact with that person. So we're trying to avoid using up all these test kits, for people that really should not be tested, really. Because we want to use these test kits for people that really should be tested, right? So for example, we only get 2,200 test kits every 2 weeks. So the way we've been testing, that'll run out really fast, right? So we just got our shipment last week. So imagine if we started testing like we did before, we'll run out by the end of the week. So then we have to wait another week for our shipment, and that's gonna cause delays. So we're trying to prevent that, really. So we're trying to prioritize really the ones who really need to be tested. I'm sorry, I know you're everybody's worried. Do I have COVID? But we really should maximize what we've got in terms of test kits, right? And so, I know everybody's worried. I feel it. I can see all the positives coming out of the lab results, right? And it's just that for the good of everybody, we really want to prioritize those who really should be tested. For example, people in quarantine. We prioritize people coming out of quarantine to get swabbed every day. We try to do those first from GMH. So it's to maximize what we've got. That is really the aim.
Annette, what can you tell us about the 53 positives that were reported over the weekend? These are strictly from public health tests, right?
These were tests, yes, done either through Public Health Lab or at our Northern Community Health Center. And again, DLS is assisting us with testing as well. So we've had 36 on one day and then 17 on the next day. And so we do have individuals within that group of 53 that were identified as close contacts and were scheduled and tested. And so again, this is where our focus is to try and get these people tested as quickly as possible. And if I can just comment that in regards to what Dr. Wen had mentioned, those clinics that do have the 7 Abbott ID machines, yes, they're utilizing that. However, we're also still receiving specimens to be tested on the other testing platforms run by Public Health Lab. And so again, the clinics are still sending us specimens to test their clients on a daily basis. Again, we're getting it from private, public entities, as well as the hospitals. And so again, there's still the other testing option that Public Health Lab runs, in addition to what the private clinics who have the Abbott machines are utilizing for their clients as well.
Have we, and I heard something last week, have we made any outreach to the military naval hospital? They can run tests there, or maybe even the NMI? Or what are we doing to expand the capability we have to run a significant amount of tests every day?
Yes, we've been in communication with U.S. Naval Hospital. They also are seeing a surge in number of patients wanting to be tested at their facility, and so they're inundated as well. In addition to us reaching out to DLS, providing those Abbott ID machines to the 7 clinics as mentioned by Dr. Kaneshiro, we are also expanding out to another contracted lab to assist us with running tests on our behalf.
If we knew what our limitations were when we started this whole thing, it just seems that we wouldn't be in the position we are today. And so I'm just wondering, why didn't we put in or plan, for this, if we knew that our limitations were, what would you say, 300 a day? We only get 2,200 test kits every 2 weeks. And instead we had all these mass community testing, and we knew that we only had a certain capacity in our storage facilities. It just seems like what is that? The orchestration of our own demise.
Oh. What I mean, yeah, ladies. So
when we did our outreaches, for the villages, we saw 500, 600, 700. We were okay. Maybe it took 2-3 days, right, to test. But then we saw this when we invited all these other clinics to join, it was actually overwhelmingly. It was surprising that actually it was so many people that actually turned out. So maybe we didn't anticipate that there were so many people that were going to come out that particular day in all these different clinics. So maybe we should have anticipated that, because the positives were going up. So we should have anticipated, but there was a call for the outreach to take place, right? So for the demand for the patients. So we were trying to do that for them.
thank you, Doc. Let me break in real quick. It's 8 o'clock or KUAM FM and Agotni, Guam, to our viewers on KUAM TV 11?
TV8.
TV8?
Monday.
I'm sorry.
TV8.
Yeah. To our viewers on KUAM TV8. Jump on over to our live stream on our KUAM News Facebook page. We're doing the live stream there, of course. You can catch us on the Breeze 93.9. That's KUAM FM in Hagåtña, Guam. It is the link on the Breeze. Proudly brought to you by First Hawaiian Bank, IT&E, Calvo Enterprises. We'll see you at TV8. And now back to our interview in progress. We have the Chief Public Health Officer for the Territory of Guam, Dr. Suzanne Kaneshiro, and also Annette Uggan, who is with the Contact Trace Division of Public Health. Annette, I guess we'll just throw it over to you. What can you tell us about the contact tracing, the mass? I mean, I'm assuming, like you had said last week, plenty TT contact trace investigations. Where are we and what are you finding out?
Again, we are dealing with multiple families and household members or community contacts. And unfortunately, this has been like a ripple effect for those who we've connected to previous cases. Again, numerous reports of they had a get together, they went out, they went to a party, they went to a barbecue, they hung out at the beach, they hung out at a restaurant or at a bar. And so those are the things that, again, with this disease, 5 to 7 days after your exposures, that when some people will start to exhibit symptoms, then you're worried about it being spread within your own household and who you work with. And so that's again what we're seeing right now is the consequences when people let down their guards. They didn't practice the social distancing. We hear numerous reports of, oh yeah, they went to a rosary, they went to the bar, they went to a party, they hung out together, but not everyone was wearing masks or practicing the social distancing that we've been pushing out there, as well as you guys, you know, KOM and all the other media have been pushing out there with the to get the word out and to educate people and to help contain the spread.
Right. Annette, since we all know that we've got this backlog of results just waiting in the freezer, which hopefully will be cleared out today, do we have a backlog of, I guess, contact investigations? I know that, you know, you said earlier that public health has the ability to scale up and scale down, but are you guys caught up with all of these contact investigations that have had to be launched? Because it's like every single day, you know, I mean, the numbers are just terrible.
Yes, and so we've actually had to bring on additional public health staff. We'll actually be getting more support this week as well, thanks to our other government agencies, and due to the lockdown that they have staff that can assist us. And so we've had to bring on more staff. With some of these cases, unfortunately, they're in the same household, and so that makes contact tracing a lot easier because pretty much the interviews have been done. It's for those individuals that go out to continue to go to work, or we're in a different household, and so our staff continue to work day and night. They worked over the weekend to do the catch up, and I'd just like to emphasize that when we get a new positive case, our department has to wait for the official report coming out from, especially if it's from another provider or hospital that tested the individual, and so we wait for the official report. But the new case is already informing their family and their friends and their employer, and so of course that word of mouth is going out faster, and so we're being inundated as well with, oh, I'm a contact, so and so told me that a family member, and oh, I hung out with someone 2 weeks ago. And so we still have to weed out, are you really a close contact? Were you exposed during the infectious period? Because then we need to focus on them, and then we look, okay, you may have been in the same building, but were you on the same floor? Were you in the same office? And so we have to do a risk assessment for all of these people claiming they're contacts or identified as contacts. And are you a lower risk, or are you what we consider medium to high risk? Because yes, you were within the 6 feet in that enclosed office space, versus another coworker who was in a totally different office on a different floor. You may have been in the same building, but you are not what's considered a close contact. So again, we are focusing on what we follow with CDC guidance of within 6 feet for 15 minutes or more. And so those are the ones that we focus on, and we are scheduling them to get tested through the Northern Community Health Center. And so now their results will be coming out faster while we close in on the backlog that we had from last week.
Right.
You said GovGuam agencies. Did you say that employees from other GovGuam agencies are now augmenting public health?
Yes, we've thankfully throughout this whole pandemic, we've been having the support not only from the National Guard, but with Guam DOE. We have the social workers and we have the nurses helping us, as well as now we're getting assistance like from DYA with their social workers as well, community program aides. We've had other agencies who are have requested, can we be trained to do contact tracing within our own agency if we need that? And so that's something, again, that we are coordinating through our leadership and the respective agencies. So again, we can expand the number of contact tracers that we have, or God forbid, if they were to have a case within their agency, that they'll be able to work in partnership with public health to handle their own contact tracing and report back to public health. And that will ease the burden on our staff. So while we concentrate on other cases and their contacts.
Do you know which agencies have their own contact trace teams then?
No, not yet. That is the plan, is to
Okay.
train up individuals.
Okay. Did you have any?
Yeah, I wanted to ask about this. So there's this story of a guy in quarantine that made it all over the national news, and we're actually going to bring him on in a couple minutes, but we haven't heard public health side of it. And I wanted to bring, I mean, you guys come on all the time, so I'm just curious, What's your reaction to these media reports about Monte Willis, who was here to bid on a Department of Defense contract? And I'm a little fuzzy, and we'll get him on, but it seems like he really came to Guam at a time when our quarantine protocol totally changed. He's been in quarantine. He's making a big issue about COVID-19 test result that he was given, in which his name was listed on the result, but then I guess all the other information, according to him, was not correct. So can we just get the department's just response to this instance, and then we'll bring on Monte to kind of discuss it with you.
We're still trying to investigate what happened, to be honest, right? And people at the quarantine facility to determine what exactly happened to this case, right? So to let you know, we are still investigating. We haven't determined what happened.
Okay. So it's still being. Go ahead.
We're investigating. We're investigating how something like that could have happened in quarantine, and it never happened before. So we just want to know why it happened in this instance.
What are you? What are you saying? Never happened before.
It's never happened. It never happened that there was so much discrepancies for one person. Like he said, I mean, we have to investigate. I don't know what happened, so we're trying to figure out how that happened.
What can you what can you say about the authenticity of that COVID-19 test result, which is positive?
Okay, so what happened was, so his name and his room were on the paper, and so when they went to his room to swab, they made sure that was him and was his room, right? So I believe it was authentic. They went to his room. They asked, "Is this you?" It's that room, and that's what the paper had. That he had his name and his room on the paper. So I believe that test was authentic.
Annette, did you have anything to add on this?
No, I agree with Dr. Kaneshiro.
Right.
Do they fill out the paper on their own, or does public health fill out the paper for them? Because it
I
says
think
birth date was
it's-
incorrect, address was incorrect, phone number was incorrect, even his race was incorrect.
Well, it was.
How did you get the race wrong?
It was a